A very warm welcome to all to today's webinar on management of urinary incontinence. Let's put an end to the leaks, jointly presented by MIOT Hospital and the Hindu. Urinary incontinence means a person leaks urine by accident. Unable to control it, it happens unintentionally, but negatively impacts the physical and mental well-being of the person. Urologists say it is a very common problem known to affect millions of lives and also the quality of life. But there is a stigma attached to the condition, and those suffering from urinary incontinence are reluctant to seek medical help, largely due to embarrassment or the fear of being mocked at. The MIOT Hospital in Chennai is perhaps among the few centers in the country that has a dedicated clinic for urinary incontinence, offering evaluation of male and female incontinence issues and a bladder rehabilitation program. According to the hospital statistics, urinary incontinence is affecting 25 to 45% of women and 11 to 34% of older men. For today's webinar, the director of the Department of Urology at MIOT Hospital, Dr. R. Manikandan, joins us to speak about the probable causes of urinary incontinence, the common types, the treatment options available, and more. Dr. Manikandan is among the sought-after urologists in the country with 18 years experience as a general surgeon and 15 years as an expert in urology. He has treated over 5,000 patients with various types of urological ailments and performed more than 1,000 surgeries. Dr. Manikandan is the first surgeon to introduce robotic surgery in urology and performed more than 250 such procedures. His areas of interests are minimally invasive surgery, renal transplantation, anti-incontinence, and uro-oncology. Dr. Manikandan has done several fellowship programs in reconstructive and prosthetic surgery in Germany, in renal transplantation in Spain, and in robotic surgery in USA. A member of national and international surgical societies, Dr. Manikandan has close to 100 reviewed publications in reputed government journals. He is also on the government committee for inspection of renal transplant centers. So it is now over to you, Dr. Manikandan, to give you a presentation, and following which we will take questions from our audience who have joined the webinar. So a very warm welcome to you, Doctor, and over to you.
Thank you, ma'am, for the kind words. Good morning, dear viewers. It's our pleasure to be associated with the Hindu for disseminating the health-related issues to the general public. So today we are going to talk about urinary incontinence. Let's put an end to the leaks. I'm Dr. Manikandan as a director, Department of Urology at MIOT International. So most of us have heard or have encountered the oops moment. The sudden unencountered urine leaks in an unwanted environment. So this is what we hear about in Tamil, Argenta varudhu. So this term you would have heard from our friends, our family members, colleagues, where you are working in an important event or an occasion where you feel that you want to rush to the restroom. For example, if you see one of our colleagues will be standing in the queue to get an appointment or to do a work in a public place, but suddenly his mind is activated and he has to go and rush to the restroom to evacuate his bladder. This is a very embarrassing condition. It puts you off from a normal routine, and some people are very hesitant to seek help because of the embarrassment. Sometimes you maybe get stuck in the traffic, but you find there's no let out space to go and empty your bladder. You are on a nice family vacation, but suddenly you have that oops moment and you want to rush to the restroom to empty yourself. Sometimes you're in the movie theater watching a movie, but before the interval happens, you are worried that you may leak and you want to rush to the restroom, missing the important events. So basically, these kind of people experience urinary leakage or an urge to urinate when they cough, or when they sneeze, or when there is a laughter. So these are the normal occasions, normal events which provocates urinary leakage in these patients. So today we are going to talk about this, the embarrassing topic of urinary incontinence, basically to help our viewers to understand what are the reasons of urinary incontinence, how do we approach the doctors to explain our problems and trying to find a solution. So what is urinary incontinence? Urinary incontinence, urination happens involuntarily. So you have a sense of urge to pass urine, but you cannot control your urination, or you can't postpone your act of urination till you have a desired place or a desired time to go and pass urine. So this is not an unknown condition. This does not affect millions of people worldwide. It affects both the genders. Females are affected slightly higher than the males. It's about 25 to 40%. And this incontinence increases as we age. In males, it is about 10 to 30%, more so in the older men. So we need to understand why this happens and what are the possible solutions to address these problems. So why we are talking about urinary incontinence? Because it's an embarrassing and self-isolating condition. It negatively affects our mental well-being and as well as the personal hygiene as well. Patients are embarrassed. They confine themselves to their houses. They are socially ostracated, and it affects the sexual and professional life as well. They tend to isolate themselves. They don't attend family functions. So these are the very embarrassing moments for these patients with urinary incontinence. So before understanding the types of incontinence, we need to understand how the urine is formed in the our body and get expelled. So basically, the kidneys excrete the urine via two urinary tubes, and then the urine gets collected in the sac or the bladder, which is located in the lower part of the abdomen. So when the urine fills the bladder slowly descends and enters the abdominal cavity and gives a sensation for us to empty the urine. Normally, we will be able to postpone the urination till we find a socially acceptable place to pass urine, or the urgency is of the imminent situation. So we don't leak urine. This is facilitated by two important muscles, or we call as the trapdoors, which prevent the urinary leakage. That is, one is the internal sphincter at the mouth of the bladder, and second is an external sphincter. Their muscle, the activity is slightly different in these two type of muscle, but they work in unison, preventing the urinary leakage. But in some patients, they tend to leak urine. They say they want to go to the restroom frequently, or they leak urine when they are coughing, sneezing. So medically, they have been classified into stress urinary incontinence, urge urinary incontinence, or overactivity, or an overflow incontinence, or a mixture of a stress and urge in urinary incontinence, which is a mixed urinary incontinence. So first we'll talk about the urge incontinence or bladder overactivity. So as I told you before, when the bladder gets filled with urine, normally the bladder is relaxed and is receptive to accumulate more urine. But in few patients, the bladder muscles act involuntarily, try to push the urine out. Basically, they are not able to hold the urine for the desired volume, which is about 500 to 600 ml in all of us. So the patient experiences sudden urges to avoid urine, and if they are not able to find the restroom, they leak urine in their undergarments. So this also happens during the night time. So the patient wakes up more than 3 to 4 times in the night to pass urine. Subsequently, it affects their sleep pattern, and their physical activity the next day is greatly disturbed, and they are distressed. The second classification is the stress urinary incontinence, which occurs during conditions of increased intra-abdominal pressure. That's during coughing, sneezing, or sudden laughing. You feel that they pass little drops of urine involuntarily. This is very common in females, particularly who have undergone multiple pregnancies, or after some women may have poor collagen tissues, the muscles are not strong enough, and during menopause, due to the hormonal changes, these are aggravated and the patients have experienced urinary leakages. It can also occur in males, particularly after certain operative procedures for the prostate gland and certain conditions which affects the nerves of the urinary bladder. The third component is the overflow incontinence. This occurs when there is a problem in the bladder outlets, when the patient is not able to empty the urinary bladder due to the obstruction in the urinary tract. It's most commonly associated with prostate enlargement, a soft tissue enlargement which occurs in males in the 5th to 6th decades of life. It's a very common problem affecting males in the 5th to 6th decades of life. It can cause constriction in the urinary tract, and it can lead to poor urinary stream. The patients may have hesitancy that they reach a restroom, but it takes few more seconds to start the act of urination. So, or they will take a long time to empty the bladder and return back. So when you have a mixture of an urge incontinence and stress incontinence, it is called as mixed urinary incontinence. Certain females have this problem that they have to rush to the restroom to pass urine, as well as they have urine leakage during coughing and sneezing and laughing as well. So these are the most important symptoms when you should consult your doctors. So you should consult the doctors when you have the symptoms very early, so that you will be able to find a solution, probably a non-operative solutions when you reach the doctors in the early stage. So when you are not able to empty the bladder completely, or when you have a coughing, urine leakage during coughing and sneezing, these are the red flags, and you should consult your doctors or urologist to investigate this problem to get an optimal solution. So, who are likely to get these symptoms more frequently, or who are very prone to get these problems? So, as I said, the weakening of the pelvic floor muscles is a most important etiology or a leading factor for development of stress urinary incontinence. It can happen after repeated pregnancies or women in the menopausal age group who have weak pelvic floor muscles, or there is a poor pelvic floor muscles in certain families. Secondly, it can be due to the blockage in the urinary system. The bladder changes can happen as a result of aging. Certain psychiatric conditions like anxiety, depression can provoke this. Diabetes due to increased urinary production. Pregnancy, neurological problems, spinal cord injuries due to trauma or spinal surgeries, prostate enlargement, and certain surgeries can lead to urinary leakage. That's like after removing the uterus, some patients, due to predominantly a difficult surgery, can develop urinary fistula, where they will have a communication from the bladder to the external surface, and then they start leaking urine involuntarily. So these are the most common problems which can lead to urinary incontinence or urinary leakages. So when you consult with your urologist, so first they will like to advise you to do a few basic investigations to understand what is the problem and how to fit you into the appropriate diagnosis. So first and foremost is a very simple a recording which is called a bladder diary. The doctor will advise you to record your urinary frequency, the leakage episodes in a paper, and then the amount of water intake. Second, they will advise you to get a urine microscopic analysis just to look out whether you have infections or stones or casts in the urine. Then we'll advise for an ultrasonogram to look at the healthiness of the kidneys, whether there's swelling or hydronephrosis of the kidneys, or how is the status of bladder, how much of urine stays back in the bladder after you empty your urination. Next comes the uroflowmetry. This is nothing but a simpler test where you pass urine in the machine and it detects your urinary flow rates. Once we have done all these things, some of the patients, a subset of patients, will require an advanced investigation called as urodynamic evaluation to find out the cause of the urinary incontinence. Basically, they help us to find out the cause and prognosticate these patients and whether surgery will help them to overcome these conditions. So finally, for all this evaluation is done, we have a diagnosis and then we come to the treatment strategy. So the solutions offered are basically of two types. One is a non-surgical intervention and second is a surgical intervention. Majority of the patients can get cured in a non-surgical methods if they approach the doctors early with the problems rather than delaying the treatment for a long periods of time. So in the non-surgical treatment, the most important, the first treatment strategy which we adopt is a lifestyle modification, where I advise the patients about their water intake, their urinary habits. We tell them you go and empty the bladder at fixed hours, or double voiding, where you go empty and then you empty after 15-20 minutes. These are the lifestyle modification. Avoid certain medications, drink less water during the evening hours, avoid fizzy drinks. So these are the most important things. Second thing is when patients have urinary leakage during coughing, that's basically weakness of the pelvic floor muscles. We recommend strengthening of the pelvic floor muscles by certain special exercises called Kegels exercises. So this helps in a remodeling of your pelvic floor muscles and helps in achieving continence. At MIOT International, we have a comprehensive rehab program, we are a specialist of the physiotherapists and the rehab specialists. They interact with patients and then they help you understand your pelvic muscles and help in their recovery. As we know that this is a very embarrassing problem and a problem where people don't want to come and discuss in public. So there's a team of psychologists, psychiatrists who can talk with these patients and then reassure them and help them out of these problems as well. So after this patients who undergo the lifestyle modification, we have augment this with medical treatment where the 3 group of medicines are available. They basically relax the bladder and help the patients to postpone their urination and reduce the urinary frequency and urinary incontinence. Basically, medical management works very well for overactive bladder or urge urinary incontinence. Once they try these medications, they'll be able to reduce the urinary frequency along with the lifestyle medication modifications. So if the patients have exhausted these the above two options, then we look at the option for a surgical solution to these urinary problems. Particularly females with urinary leakage during coughing, sneezing, or laughing, they can be very well helped and cured by very simpler procedures called as transvaginal tape procedures. It's a small procedure where we use a small mesh to tighten the pelvic floor muscles and lift the urethra. So the conditions of increased abdominal pressure like coughing, it straightens the urinary tube and prevents the urine leakage. Some patients may get benefited by a procedure called Birch-Colpo suspension. Second group is the patients of overactive bladder who are not responding to the medicines which we described the previous slides. So these patients can be benefited by a small injection called as a botulinum toxin injection, into the bladder muscles, which can cause temporary controlled paralysis of the bladder muscles and reduces the urinary frequency. There are some subset of patients who have problems due to the neurologic conditions, that is, the nerves which are supplying the urinary bladder are affected. Subsequently, they are not able to empty the bladder, and they have kidney enlargement and as well as renal failure. They will require what is called as augmentation cystoplasty. It's a major procedure where we open the bladder and we substitute the bladder with a small segment of small intestine to increase the bladder capacity and to reduce the urinary incontinence episodes. There's a specialized treatment called as implantation of an artificial sphincter is available. This is particularly for patients who are undergone, for males who are undergone prostate surgeries and who leak urine when they stand or they use diapers when they are not able to control their urination, where a device is inserted surrounding the urinary tube and they can mechanically cause blockage of the urinary tubes and can facilitate urination as and when necessary, which can be activated with the patient as well. So the purpose of this presentation is to make the general public understand that they can achieve freedom from the common rushing words, the urgent from urgent hour. This is the most embarrassing word which happens when we are in a meeting or when we are in a public functions, when you are not able to spend quality time with our family members. So we'll be able to achieve good cure for this incontinence and make the patients free from the use of diapers. So we'd like to take this opportunity to inform our viewers that the MIOT International is conducting a urinary incontinence week, special consultation camp from 22nd to 26th September. Patients who have problems of the above problems can visit us and try to find a solution for these problems. Hopefully, we'll be able to deliver the anti-incontinence treatment to these patients. Thank you.
Thank you, Dr. Manikandan. That was a very, very informative and exhaustive slide presentation, which explains a lot of things very clearly. So I was just thinking after listening to you, like as you explained that coughing, sneezing, or laughing, that could lead to some, say, few drops of urine leakage. So which exactly would be the right stage to approach a neurologist? I mean, are these the earliest symptoms and people should be alert to and then immediately go to a neurologist? I mean, at what stage should a person go to a urologist?
Actually, when the patients start having these problems at the early stage, initially it will be an occasional urine leakage during coughing or sneezing or lifting heavy weights or doing brisk walking. That is an ideal stage where you should consult a neurologist to identify the problem. And as I said, we can go in for a non-surgical management for this problem. But once it gets established and your pelvic floor muscles gets weakened, then it may be too late. So the earlier, the better.
And what is the reason for pelvic floor muscles weakening? In women, is it that pregnancy or what are the other reasons?
For females, the most important thing is post-pregnancy, or it can happen during the menopausal stage when the hormonal support to the pelvic floor muscles gets diminished. It can happen in certain conditions after pelvic trauma, but it's very small percentage of patients. It can happen in men after prostate surgeries, where the support of the bladder neck, the muscles which I told you about, the trapdoor muscles get weakened or get ablated with surgeries. These patients are the ones who are more vulnerable to develop these problems.
So what happens if this urinary incontinence is kind of left untreated for a long time? What are the side effects? Like, is there a risk of causing more damage to some other organs? Apart from, of course, you did explain about the mental well-being and all, but does a person also face other risks if it
Yeah.
is left untreated for a longer period?
Yeah, most of the patients, once they start having this incontinence very frequently, they start using the diapers. So diapers, the long-term usage causes skin problems, skin excoriations, foul smelling. So that is one of the most common side effects. Second thing is that in certain patients, as I told you, the patients who have neurological problems, the nerves supplying the bladder gets weakened. So the patients just empty 50 to 100 ml of urine very frequently, but still the urine gets collected in the bladder. They causes secondary back pressure change in the kidneys, leading to renal failure. So that's a very dangerous problem to have. So that needs to be corrected at the earliest.
To what extent do exercises really help in controlling urinary incontinence? You did mention about the Kegel exercise and all, because you started receiving questions. I'll now start taking one by one. But if you could just explain a little bit on the importance of exercising.
As I suggest
Whether
told you
it can
before,
be, whether also it can be home managed, if a person is regularly exercising.
as I told you, the first the treatment doing the treatment options, the exercises is one of the most sheet anchor role in the treatment of urinary incontinence for females as well as in males. They need to be taught how to contract the muscles. So all the international guidelines suggest the lifestyle modification and Kegel exercises as a first entry point in the treatment strategy for patients with stress urinary incontinence. So we teach the patients how to contract those muscles and do it repeatedly in their house. So when they're able to do it again and again, the muscle fibers get recruited and they're able to achieve the better outcomes.
So is it possible to reverse urinary incontinence?
Definitely. When the patients approach to us on the early stages of urinary incontinence, as I say, an occasional incontinence episodes, they can be very well treated with exercises and lifestyle modification.
Okay, so I'll start taking the questions. Panir Selvam is saying that can we do the following mudras to control urinary incontinence? And in specifically, he mentions Indra Mudra and Abhina Mudra.
I'm not an expert in mudras and things, but in any exercises which helps in improving the perineal muscles, that's what the aim is. That will help in recovery, control the urination leakage episodes as well. So just new names have been given as a Kegel exercise. So each geographic region has a different names, but the whole purpose is to strengthen the pelvic floor muscles to achieve the objective.
So there are some disease specific or ailment specific questions, like somebody is asking, what are the remedies for urine incontinence due to neurological problems since birth? And what are the medicines prescribed for neurogenic urinary bladder?
Yeah, that's a very important question. There was a subset of population, particularly even in the pediatric age group, in an adolescent age group, where birth defects like meningocele, meningomyelin, basically they affect the spinal cords, where, as I suggested, that the bladder is not able to empty effectively, leading to compression of the kidneys and renal failure. So we need to understand what is their primary problems, and we have to do the urodynamic test to identify the problem, accurately establish the diagnosis, and probably a surgical treatment will help these patients. We have to allow the bladder to fill the urine by increasing the bladder capacity and augment it with medicines, medical management as well.
So if somebody with a 6-year-old child, the child is still bedwetting, so should that be a matter of concern?
Yeah, we mostly our children achieve the urinary continence, the social continence by 3 to 4 years of age. But sometimes there are children who have bedwetting in the night. Basically, they go into deep sleep, and then there's lack of awareness to wake up and when the bladder is full and to go to the restroom. So these children needs to be treated. You have to rule out constipation or any bowel disturbances. That's one of the important reasons for these kind of incontinence issues. They can be treated by non-surgical, non-medical management, like alarm clock ticking. That's what we tell the parents to wake up the child at fixed hours in the night, like 1 or 2 times, and wake the child to make the child aware that the bladder is getting filled, to go on a restroom and empty the bladder. If that doesn't work, then there are some medications available which we prescribe to them to achieve continence. So these kind of patients we see frequently in practice. Even children about 10 years, 12 years who continue to bed 3 to 4 times in a week, they bed during their sleep.
Gopal Krishnan says he recently had a test on PSA and it shows in the report as 8.20. But he says he didn't have any urinary problem and is taking one tablet, Tramstream D, at night. So he's asking for your suggestions.
Mr. Gopal Krishnan, the serum PSA test is done to identify whether there is a prostate cancer. That's a biomarker. So if the normal value is below 4, 0 to 4 is a normal value for a serum PSA. If the PSA level is more than 4, then it is imperative that it needs to be further investigated. The most important test would be an MRI scan of the prostate. It is called as a multiparametric MRI scan, which will help us to find out whether there are suspicious areas of cancer in your prostate, leading to whether to take a decision to do prostate biopsy or not. So please don't ignore it. Consult your doctor and then go and get this scan to further prognosticate the problem.
So Ramanathan Kumar says that he's undergone prostate surgeries and incontinence is common after that. So how long will it take to recover?
Incontinence is not common after the modern day prostate surgeries. It varies about 2 to 3%. It depends on various anatomical as well as the physiological factors, which is the patient presents to the urologist for the prostate surgery. So the patient may have a de novo weakening of the pelvic floor muscles or overactivity of the bladder, which gets aggravated by the surgery. So ideally, we give medicines for 12 months. That is an important waiting period. After 1 year, if they don't improve with medications, then surgical option is a strategy.
Tangarasu K, who's a 55-year-old male, writes that I'm getting pain in my urinary tip, and he's a diabetic with heart issues. So he's asking for your.
Basically, Mr. Tangarasu has to get a urine test, urine microscopic test, and a culture test to rule out urinary tract infection, and an ultrasonogram to find out whether there are stones in the bladder or the prostate is an issue for these patients. If the urine shows infection, signs of infection, then we need to treat it with antibiotics, or he may need certain medicines to treat the prostatitis. That's the inflammation of the prostate, which can lead to pain in the tip of the penis or pain in the urinary tract or pain in the perineum. So these are the usual symptoms of a prostatitis.
So does urinary bladder cancer also cause urinary incontinence, and how does one treat it?
Sometimes, occasionally, patients who are, say, a neglected patient who presents very late to the urologist, and the bladder may be blocked with the bladder cancer, the tumor cells, and can present with the urinary incontinence. So that is a very uncommon cause for urinary incontinence. So we treat the bladder cancer by endoscopic methods, cystoscopy, And if the bladder tumor is in an advanced stage, then we offer the removal of the bladder and creating a new bladder. It's called as orthotopic neobladder, which is attached to the patient's normal urinary passage, and he will be able to pass urine even though the native bladder is removed. It's one of the advanced surgical options which we offer at our center.
Prince wants you to explain uroflowmetry once again and how does it work, because his urologist has suggested this to him.
Mr. Prince, the uroflowmetry is just a technical jargon. Don't get confused by that term. You just have to go with a full bladder, and then you have to pass urine in a urinal, which is attached to a machine. The urinal will measure your urinary flow rate. The most important thing is that you should pass at least 200 to 250 ml of urine to have a meaningful study. So the results are instantaneous, and the machine calibrates your urinary flow to assess the peak flow rate as well as the average flow rate, and that will be interpreted by a urologist.
What causes and how to treat post-void dribbling in middle-aged men?
The most important reason for a post-void dribble is that the patients are not able to empty the bladder effectively due to an obstruction in the urinary flow. That is common due to the prostate enlargement, or it can be due to a urethral stricture disease. That's a soft tissue growth in the urethra blocking the urinary flow rates. So we need to differentiate these two. This I am talking for a male. Sometimes the neurological conditions which we discussed before can also present as an overflow incontinence. The patients will start dribbling of urine and always say that there's a discomfort in the lower abdomen. They are not completely free. They say they want to go and empty the bladder once more. So these are the warning signs, and the patient needs to be evaluated for the above conditions, and a solution will be suggested to them according to the underlying existing problems.
Then how to arrest urine incontinence during sexual intercourse? Asking.
Some patients may have an anxiety issue. Particularly when their partners, they may feel because of the anxiety, they may have this sensation of urination. What would I just suggest to these patients that they have to go to the restroom and get emptied themselves, and particularly in females, post-sexual intercourse, some patients may have sudden urge to pass urine. So better for them to empty the bladder before going to bed. That will be an ideal option. If things are not improving, then they need to be investigated for the reasons mentioned above. What is the cause of incontinence? We need to find and address them.
So Amreen Banu, who's a 45-year-old working professional, she says she has the urge to use the washroom every 45 minutes to 1 hour. So is it serious? She has consulted the doctor. She has been prescribed antibiotics. She has got her urine culture done, ultrasounds done, but her issue still continues.
Sabrine, the issue which we are talking about may not be an underlying urinary tract infection. So this is probably an overactive bladder, which can occur de novo. It's called as idiopathic overactive bladder. Those can be treated effectively with medications. A group of medicines called anticholinergic medications are available. So they can be started with to correct this problem. Plus, the most important thing is a lifestyle modification, where we address the patients to reduce their water intake, to restrict the fluids to about 1.5 to 2 liters per day, and along with the medications, we'll be able to achieve a cure for this condition. Please consult your urologist. He'll be able to help you with this condition.
So there are a couple of questions on like what would be the important lifestyle modifications, that would help to perhaps reverse urinary incontinence.
Some patients, typically they may, as we had a previous our viewer, they'll have an intense urge to empty the bladder every half an hour, 45 minutes. So apart from the medicines, we tell them to reduce the water intake, reduce fluids after 5 o'clock in the evening, reduce your coffee, tea, milk, juices, soups. And other thing is to preemptively go and empty your bladder. To have a timed voiding, say once in 3 to 4 hours, you empty the bladder. You will know how much urine you are passing every time. So based on that, every 2 to 3 hours, you can empty the bladder. So this embarrassing situation of an intense urge is avoided. Secondly, some patients, they empty the bladder only half. So we tell them you wait for a few minutes and then you pass the urine again. So to empty the bladder. So this kind of small lifestyle modification goes a long way in improving the confidence of the patient till the medicine starts working, and the medicines will augment this response.
Gautam Muttayan is asking, how would be the prognosis of patient who has undergone a surgery with intraurethral sphincter? Will they require any follow-ups?
The implantation of the artificial sphincter is an advanced surgical procedure which we do for patients who have incontinence primarily due to prostate surgeries, or in females who are not getting treated by the conventional treatments. So this is a mechanical device which we insert surgically. On the device, the patient activates the device to empty the bladder effectively. These patients need to have under close follow to understand how the device works and to identify if there is any mechanical failure in the areas. So they need to be in regular follow with the doctors, and it's an advanced surgical procedure that's being offered for these patients to overcome the urinary incontinence, which are not treated by the conventional existing methodology.
There's a geriatric care question from Subbulakshmi Balasubramanian, who wants to know how to manage an elderly people with urgency, having minimal prostatic hypertrophy and minimal residual urine.
Yeah, the patient profile which you described as a typical patient who has bladder overactivity. So what we suggest them is to restrict the fluid intake, start medication to relax the bladder, and practice timed voiding, and find out is there any other issues aggravating the problem, like diabetes or any medications which increases the urinary frequency. So these are the things need to be understood. Another important thing is, as we age beyond 60, 70 years, the normal physiology of the human body is to produce more urine in the nighttime than during the daytime. So if somebody is passing 1.5 liters of urine per day, he may be passing producing 800, 900 of urine in the nighttime rather than about 600, 700 ml in the daytime. That's a normal physiology. So you need to get adjusted to that and drink less water and empty the bladder frequently as far as possible. And of course, medicines will help you a lot in this working in this situation.
Rajiv is asking the role of testosterone levels in urinary incontinence in aging males.
Testosterone levels are not routinely checked and employed in this disease, but testosterone level we check in the patients having a prostate cancer who are undergone treatment for prostate cancer. That can also have an impact on the urinary incontinence. So it is not a direct prognostic factor to understand the healthiness of the tissues.
Mridula Narasimhan had, over a period of 7 years, developed surgical hernia twice. And 1.5 months ago, she had a laparoscopic surgery with 15 into 15 centimeter mesh put. She wants to know, when could she start pelvic exercises?
Madam, these patients, the hernia is a result of increased intra-abdominal pressure. So usually the mesh, purpose of inserting a mesh is to increase the tissue fibrosis in the weakened hernial area. So after 3 to 6 months, the patients will achieve about 90% of their muscle strength before surgery. The pre-surgical levels they reach by 3 to 6 months. So after 6 months is a safe time to start their pelvic floor therapy, but they can slowly start doing it after 3 months, 3 to 4 months.
Sukuman Munuswamy is asking, can we continue with medication for BPH without going for surgery, or is surgery a permanent cure for BPH?
No, if the patient is happy with the urinary flow and all the urinary parameters are normal after consulting with their urologist, you can very well continue medications for BPH. Surgery, indication for surgery are very, very well defined. Either the medicines are not working, or you develop repeated urinary tract infections, you develop bleeding in the urine, blood in the urine, or you form stones in the bladder because you're not emptying the bladder effectively, or you wake up more frequent in the night, as well as when the urinary stream is very, very thin, the flow rate is slow. These are the important indications to opt for surgical treatment. As far as you are happy with the medication, your parameters are within normal limits, you can continue taking the medicines.
Sir, like you've been, while answering questions, you've repeated that it is better to reduce the intake of fluids, perhaps. But a lot of people have this habit of, drinking a full glass of water before taking meals or drinking water before going to bed. So Sundari is asking whether all these are okay to do.
Some patients, as we talked about, have overactive bladder. So in those patients, it's very imperative to reduce the water intake, particularly during evening hours when you're staying at home, when you're in a ambient temperature. So when the sweating doesn't happen, so the urination increases. So that's why we tell the patients to reduce your water intake during evening hours, particularly caffeine. It stimulates the increased urine production as well. The patients who doesn't have this problem can continue to take the fluids. But patients with this underlying problem of overactive bladder, generally it is better to restrict fluid to 500 to 700 ml of fluids post dinner or close to the dinner time. So by the time when they go to bed, they are already emptied the bladder once.
Sahin Abba's uncle underwent prostate surgery and he is leaking urine. She wants your advice.
Madam, as I suggested that we continue conservative or medical management for 12 months. Even after 12 months, if the patient has not recovered, then we have to investigate by the urodynamics test. And if we find that the intrinsic sphincter deficient, that's a muscle which is closing the bladder neck as a trapdoor is weakened or it is inactive, then he will have to undergo the implantation of the artificial sphincter. That is the best and the effective strategy to counteract the urinary leakage following prostate surgery if there has not settled more than 12 months. 12 months is a very important cutoff time. Beyond that, the spontaneous recovery is very limited.
Somebody with L2, L3 problems wants to know, does it contribute to frequency of urination?
Yeah, it can. The nerves arises from the bladder, supplies the bladder from the L4, L5, S1 region. The L5, S1 is the most important thing. But these patients can have secondary changes down the spine regions. So they can activate the bladder muscles, can lead to bladder overactivity. They can go and pass urine frequently. The other very important problem is that these patients may have overflow incontinence, not necessarily an overactive bladder. They're not effectively emptying the bladder because the muscle have become weak, which is called as hypocontractile bladder. That's a little more dangerous situation. So you need to consult the urologist as well as the spine team, spine surgeons, who will effectively evaluate this problem and offer a surgical solution if the spine is compressing the nerves.
So there are some questions for patients with spinal cord injuries, Parkinson's, and other neurological conditions. They want to know what treatment can be offered. For instance, somebody is asking about his 71-year-old grandfather who has Parkinson's and is on urinary catheter. So would you advise surgery?
Basically, the main aim of the surgical of the treatment is to get rid of the catheters. Any catheter, foreign body in the human body is not good. The catheters can cause pain, discomfort, stone formation, infections. So these patients need to get evaluated by the neurologist as well as the urologist. They will make a strategy, devise a plan. We'll do the urodynamic evaluation and help them with the rehabilitation program and start medications. These and lifestyle changes. These all will effectively help in helping the patient free of catheter, and we'll be able to find a solution for these patients. But these patients will be options will be tailored for the patient's problem, depending on the severity of the underlying neurological conditions as well.
So Ramkumar Krishnan wants to know whether there are any other external devices that can be used other than diapers.
The patients, yes, the patients are, we talked about patients with prostate surgeries who have incontinence. There are some clamps which are available which can help us in putting a mechanical block to the urination. But these devices should be used under extreme care, under the advice of the treating urologist, and they are not a long-term solution. They will cause skin problems and excoriations, damage to the penile skin. So they have to be used with caution. Yes, there are some devices available, but the time duration for the usage should be limited.
I'll quickly take a couple of questions from women, particularly who there is one 25-year-old lady who says that she has urinary incontinence during the night time and bedwetting is also there, but it is not a routine. It happens like weekly once or maximum twice.
So these patients, there are two categories. One, they might have achieved continence when they are a childhood or adolescent, and suddenly they are becoming incontinent. Few incontinence episodes happen, which is called secondary nocturnal enuresis. They need to be educated to reduce the water intake, wake up in the night once, say at 1 o'clock or 2 o'clock, to go and empty the bladder, and they need to be started on medications. So these three strategies will help them to overcome this situation and achieve continence. So this is not a problem. It's not a very challenging problem. This can be effectively solved by few simple medications.
So another lady who was told by her doctor that his uterus has dropped down, and even after she urinates, her bladder feels full.
These are results of the weakening of the pelvic floor muscles, where the uterus and the bladder gets pulled down, and then they even sometimes comes out of the introitus or the vaginal opening. So if the descent is of the higher order, say grade 2, grade 3, they need to be evaluated, and probably a surgical treatment will help these patients, particularly by tightening of the pelvic floor muscles and lifting the prolapsed or the descended bladder into the abdominal cavity. That will solve their problem.
Another 66-year-old woman with diabetes, she says, I usually drink milk before going to bed. Can I drink water before going to bed? Which is good, sir?
Patients with diabetes, they form more urination because of the glucose which is filtered by the kidneys draws the water and produces more urination. So the advice is that better to restrict all the fluid intake by 7:30 in the evening hours, and not to take anything more in the night times. That will reduce the urine formation and help reduce the urinary frequency. And of course, medicines will help. So avoid milk during night time. That's the best strategy. Better to restrict them before 4 to 4:30 in the evening hours.
Doraiswamy Ramaswamy has been on Urimax D for the last 12 years, and though his prostate gland has become normal, so he wants to know whether he should continue.
Usually this medication, this combination of tamsulosin and dutasteride needs to be continued lifelong for patients with prostate symptoms. But if he feels that he has been improved and he he wants to stop the medication, it's better to consult his urologist to find out whether everything is good, okay, and then take a call on that rather than abruptly stopping the medications.
Uday Kumar wants to know continuous itching around the urinary area. Is it any kind of symptom for any urinary disorder?
No, itching can be due to skin issues or can be due to excessive sweating. Can be irritated by the undergarments. All those things can lead to itching, but better to get a urine microscopic test and probably a urine culture test to find out is there any other existing problems, and take advice of the urologist.
Okay. And somebody is also asking about the different kinds of catheters that are used. How do they help, or how are they kind of, at an advantage, or benefits or disadvantages?
There are basically two types of catheters. One is for catheter for long-term indwelling use, that we use basically silicone catheters. And the other one is the rubber latex catheter, which is used for short-term catheterization, particularly post-surgical. There are certain group of patients who needs to empty the bladder. All these medications which we talked about, the medicines may not help for them to empty the bladder, particularly when the bladder muscles have become very weak. So they do self-catheterization. It's called as clean intermittent self-catheterization, CISC, wherein they empty the bladder by themselves. For them, there are certain catheters, enlightening catheters, foot tip catheters are available, short catheters, where they use 4 to 6 times per day by themselves. And then they reuse those catheters after cleaning them and placing in a good storage space. So there are different catheters for different kind of usages are available, but long-term catheters are usages by using of silicone catheters.
Shafina Begum wants to know of a remedy for those suffering from severe pain when the bladder is full.
These are the symptoms of what is called as a painful bladder syndrome or interstitial cystitis complex, where these patients have severe lower abdominal pain, the discomfort in the lower abdomen, pain during passing urination, frequency of urination. So this forms the complex of a painful bladder syndrome called as or interstitial cystitis complex. These patients need to be investigated to find out is there any other problems in the bladder, like stones or an infection. Once we rule out that there's no infection, then the treatment strategy will follow two pathways. One, to reduce the pain. These patients have been suffering for a long duration of time. So we address the pain issue as a first and reduce medications to reduce the urinary frequency as well. Some patients are falling under this category may not get cured by these medicines also. They require endoscopic examination and the treatment of the problems in the bladder. So many young females do come with these problems. So they need to be treated as early as possible, or it is going to negatively impact their health, and they may avoid going out, or they may avoid socializing. So these are the potential problems of these patients. These are problems which can continue for months together, 6 months, 9 months. Some patients have been taking medicines for more than 2 years. So this is a small subset of patients who needs a very focused attention and care.
So does long-term medication have any other impact or effect? A lot of questions are on whether they cause cancer in the long run.
The medications for controlling urination doesn't cause cancer, but need to be looked out for other associated problems with medications. Sometimes they may have dryness of throat, mouth, some upper abdominal discomfort that needs to be addressed for these patients. When we give a powerful medicines, they know to have some side effects that can be circumvented by additional medications or changes the lifestyles. But the most important thing is to achieve urinary continence, so the confidence level is there. Otherwise, they get feel neglected and they don't seek treatment.
Right. Yeah. So we'll wind up with one final question from Mr. Gopal Rajagopalan, who's repeatedly asking about more details on personal lifestyle changes. He's 86 years old and he wants to know how being at home, what he should do to prevent.
So, Mr. Rajagopalan, being in 86 years old, yeah, you may have problems of increased urinary frequency, nighttime urination, or your urinary speed may be slow. You may be having urgency before reaching your restroom. You may leak few drops of urine in the undergarment. These may be the problems you'll be encountered in this age group. Particularly when your mentation is lower, you may find difficulty to wake up in the night, and your daytime sleep pattern may be affected. You may drowse off in the morning hours. In the night, you may not be able to have a good sleep. So basically, the problems can be of two types. One is a problem due to the prostate enlargement, which affects the bladder secondary, or it can be per se the bladder problem, de novo bladder overactivity. These two has to be differentiated clearly by the test which we have described about, discussed about. Once we know what is the problem, then we can treat with medications. That is one part. Second part, the most important part is the lifestyle changes, where you reduce the water intake during evening hours, restrict your tea, coffee, milk beyond, don't take beyond 5 o'clock in the evening. Frequent, or rather I would say as a timed voiding. At fixed hours, you go and empty the bladder, and maybe you can wake up once in the night to empty the bladder. So these are the important lifestyle changes. And some people, particularly in cold climates, they get aggravated by these problems. So when they're using air conditioning, better to keep it in ambient temperature and not to keep it in too colder temperatures. So these are the few things. Like food changes, avoid soups in the night, avoid milk. So this will help you to overcome your problem.
Right, sir. So would you like to kind of wind up with any kind of common public message on this particular problem, which is very, very common?
So the most important message which we would like to tell to the general public is the urinary incontinence is it's an embarrassing problem, but please seek help. There are now medical treatments are advanced, so we'll be able to solve the problems, and better to approach your doctors at the earliest when the symptoms are at the early stage. These symptoms can be cured. Don't stay at home. Please visit your urologist to get the treatment for these conditions. These are disabling conditions. It can push you into your house, but solutions are available. Please don't neglect this.
So thank you, Dr. Manikandan, for so patiently and beautifully answering so many questions and for your presentation. I think we were really able to squeeze in quite a few questions, and I'm sure our audience has some valuable takeaways from this session. I thank you once again for attending our webinar on management of urinary incontinence. Let's put an end to the leaks, jointly presented by MIOT Hospital and the Hindu. Thank you for joining.
Thank you.